there was this 30-year-old gentleman who came to my office saying that he had a severe neck pain. He usually has a desk job, he works with a computer, he sits around 8 to 10 hours every day, and he said, I woke up one day with a very severe and sore neck, severe stiff and sore neck. I could not move my neck, and I found that this pain was going to my right shoulder and also traveling down my right arm. It was going all the way down to my right thumb, and I could not move my neck, so I could not go to office. I took an off, I took rest. I woke up the next day, it still didn't go away. It's still there. And now I've come to you. How do I get rid of this? I examined him. I found that the neck, which usually has a small curve, had become straight. He was not able to move it, it has become very stiff. And I checked his arm. There was a weakness in straightening the elbow. There was a weakness in lifting the wrist up. And there was also a loss of sensation over a part of the right upper limb, the right arm and the right forearm. The shoulder, the muscles between the neck and the shoulder were also quite stiff. That led me to think that this 30-year-old who had been sitting for long hours in his office with a chair which was not so ergonomic and with a computer setup which was not very good for his neck and back, when he had sat for that long, it had affected his neck, the bones and the muscles in such a way that they became stiff. Not only that, the spinal cord which runs in the bony cage in the neck and the back was affected to an extent. That was the reason why he had that pain going down his arm. That was the reason why he had stiffness of other parts other than the neck. And I asked him, how do you sit in your office? He said, I have a chair which is quite flat. I sit for 8 to 10 hours, so I can't sit straight. I stoop down, I bend my neck, I bend my back, and I usually draw my arms forwards to use the keyboard, and I keep my neck like this to use the monitor. Somebody who is sitting for that long in that bad posture is usually likely to suffer some damage to the neck bones. Then I had to tell him to take rest, give rest to the neck muscles, take a physiotherapy massage and use muscle relaxants, not to bend his neck forward too much, restrict the movement of the neck too much, use a thin hard pillow so that it gives uniform support when he's sleeping, use a firm mattress, and when he sits, to use a good chair. The chair should be ergonomic, which means there should be good support for the neck as well as the back and a good thigh support. The keyboard should be kept close to him and the monitor should be kept away from him with it being tilted backwards. I'll just demonstrate to you what I would like the ideal setup to be. Okay. This is how most people sit. This is not a very ergonomic chair. The chair is relatively flat. This person is sitting with his neck bent forwards, with the back bent forwards. You can see this. And the keyboard is quite away from him. He has to stretch his arms to reach the keyboard. The monitor is relatively straight. He is looking with a bent neck if he has to look at the monitor. All these are problems because when the keyboard is away and the monitor is straight, through force he has to bend the neck constantly. This part, usually it should be like this, it's bent. and when this is bent constantly, there is damage to parts of the neck. What would I like the arrangement to be rather than like this? There should be neck support, there should be lumbar support. Support for the neck and support for the back. I would also like the keyboard to be quite close so that there is no excessive extension of the arms. The keyboard is quite close to him. It's slightly tilted upwards so that the elbows are very close to him. When the elbows are very close to the person, the neck is not stretched and so it's not damaged much. The monitor, it's better if it's away from him so that he's looking like this rather than straight ahead at it. So this monitor is away from him, the keyboard is close to him, tilted upwards so that the elbows are close to the body. There is a neck support, there is a back support. This is the ideal position if you have to sit for long hours in the office. With this position, it's unlikely that you are going to damage your neck or the back. With this, it's likely to recover quickly. Another common complaint which I get from people who sit for long periods is that they have a backache. This backache can be in the center, it can be on either sides of the center. Sometimes the back pain gives off a shooting pain which goes down all the way into the leg. Why does this happen? When people sit for long periods, or they bend down and pick up things constantly, or they're sitting cross-legged for long periods, or they don't have a good posture while sitting, that can harm the back, that can cause friction and degeneration of the backbone, which can lead to compression of the nerves in the backbone, leading to spasm of the muscles, tightening of the muscles in the back, leading to pain. It can lead to pressure on the nerves which go down to the leg. When there is a pressure on the nerves which go down to the leg, it feels as if there is a shooting pain going down the leg. Some people call this sciatica, not so correctly. Whatever the name is, it's important to remember that sitting for prolonged periods in an odd position aggravates this. It's important to take small breaks, 1 minute for every 15 minutes of continuous sitting, so that the back gets some relief. It's important not to bend down in a manner which aggravates the back pain. When you have to pick up things from the floor, you can kneel down and pick it up rather than bend forward and pick it up. It's also important to remember that wherever bending can be avoided, bending forwards can be avoided, it's important to avoid it. And sitting cross-legged on the floor with a bent back again can harm the back. If these things can be avoided, if exercises can be done to the neck and the back, many of the neck and back problems can be easily controlled. A good posture, avoiding excessive or unnecessary movements which can harm the back and neck, good ergonomic positions while working, and exercises of the back and neck can lead to quick recovery and prevent further damage to the back and neck.